Smarties, today we are thrilled to welcome Dr. Nicole Michaeli, a pediatric psychologist that specializes in comprehensive psychoeducational assessments here in Los Angeles. In this robust conversation, Dr. Michaeli shares all the differences between an IEP and an IEE and a private comprehensive evaluation. She shares how they are inherently different and have different goals, leading to different results and recommendations that are, guess what, used differently. She also shares some really great guidelines for helping families decide what they need and when they need it. And she also shares really important information that not enough families know about with regards to IEEs. If the work that we are doing here at Learn Smarter Podcast has been beneficial to you and your families, and we know it has because you guys call and email and tell us, it would mean the world to us if you would go ahead and leave a review and 5 stars wherever you listen to this podcast. It helps others find the podcast and means a lot to both Steph and I. So thank you in advance for going and doing that. Now let's dig in.
You want to learn faster, but sometimes working harder is just not the answer. You have to learn smarter. The Educational Therapy Podcast.
Hi, Smarties. Welcome to episode 338 of Learn Smarter, the Educational Therapy Podcast. I'm Stephanie Pitts.
And I'm Rachel Kapp.
And today we are so happy to have a guest on our podcast. Nicole, welcome to the podcast.
Thank you so much for having me. I'm so excited to be here.
We're excited to have you, and we would love to give you the opportunity to introduce yourself to our audience and share a little bit about who you are and what you do.
My name is Dr. Nicole Michaeli. I'm a pediatric psychologist, and I specialize in comprehensive psychoeducational assessments for kids, teens, and young adults. My private practice is located in West LA, and I specialize in working with kids who have learning differences and neurodevelopmental disorders like autism, attention differences, learning challenges, and other neurodevelopmental challenges.
Perfect. And today we are going to talk about the IEP versus the comprehensive assessment. So why don't you share a little bit about what an IEP is? A lot of our audience might already know, but I think it's a good baseline of understanding. And when is it necessary?
Absolutely. So let me provide a little context for listeners who might be unfamiliar with IEPs. When there are concerns with learning, social skills, or behaviors, parents can ask the school for their child to be evaluated for an IEP plan, which stands for Individualized Education Plan. This is part of federal law. It's part of the IDEA, which is the Individuals with Disabilities Education Act. Essentially, it's a plan. Technically, it's a legal document, but it's a plan that is designed to support students with disabilities in school. It has very specific goals that address their areas of need, and then services that include accommodations or different modifications that are going to be provided to help those students meet the goals in the IEP. So the purpose of the IEP assessment is that's the school's way of figuring out, does this child meet eligibility for an IEP plan? And if so, what kind of help are they going to need? So the goal of the assessment is figuring out what the student needs to be able to access the curriculum and be successful in school. So in this sense, the IEP is pretty streamlined and it targets the specific areas of need that are impacting that child's ability to learn. It's usually conducted by a team of school staff. It can include a school psychologist and different specialists like speech language pathologists, occupational therapists, behaviorists. They all work together to do this assessment and, make an eligibility decision.
So we have a lot of families that come to us saying they've done the IEP process. Is that enough? They didn't get a diagnosis, or the opposite. They did something private, but they don't have anything in place at school. So can you tell us a little bit about what the difference is?
You want to know the difference between IEP and a comprehensive, right? So the comprehensive assessment, the private comprehensive assessment, is conducted usually by a child psychologist or neuropsychologist who have specialized training in the assessment and identification of neurodevelopmental disorders. And they have an understanding of brain behavior relationships. The purpose of this assessment, in contrast to the IEP, is to be able to have the in-depth understanding of how the child's brain works, what kind of learner they are, right? What are their pattern of strengths and weaknesses? We look at a wide range of skills that essentially we refer to as their neuropsychological skills or neuropsychological functioning. So while the IEP is focused on identifying the educational needs and what that child needs in school, the comprehensive assessment really provides a holistic, broader understanding of that child that extends beyond school. So we're looking at what do they need both in school, but also across different settings in order to be the best version of themselves.
Okay, so I think it's important to note a lot of parents, the difference between the IEP process and getting the testing there and a comprehensive having to do with the diagnosis as well.
Right. Yeah. So the areas that the IEP team will look at, they're usually related to the areas of school performance, naturally, right? So areas like cognitive abilities, academic achievement, language processing, social and emotional functioning, sometimes other areas like sensory or adaptive abilities. Again, that assessment is geared towards identifying those barriers and figuring out the impact it has on the child in school. The comprehensive assessment, on the other hand, covers a much broader range of abilities. So we're looking at areas like problem-solving skills and reasoning abilities, memory, attention and executive functioning skills like planning, organization. And then it also provides a really thorough picture of that child's social and emotional world. So what are their personality characteristics? How do they view themselves and others? And how do they self-regulate, right? So looking at a broader range of skills, a more wider range, if you will, and then also on a deeper level as well.
So a diagnosis would happen in a private assessment, but a diagnosis won't happen at a school assessment.
Right. Great question. So that's a point of confusion for a lot of families because they often see diagnostic looking labels on the IEP documentation. If they do get an IEP, it might say like learning disability or autism, and they mistakenly might think that it's a diagnosis. But what we're actually seeing is the specific eligibility categories under which that student qualifies for services. So there are 13 different disabilities that are outlined in federal law. And if a student is found to have one of those disabilities, and if it's found to negatively impact their performance, then they would be eligible for an IEP. But this is not a medical diagnosis, it's an educational classification. And again, that's where a lot of families get confused. On the other hand, the comprehensive assessment, we're providing a clinical diagnosis. We're using the information obtained for the assessment to make diagnoses and identify conditions like, say, autism, specific learning disabilities, ADHD, mood disorders, et cetera.
Let's say the family comes to you first, they get a comprehensive assessment, they realize they need to go and do the IEP, right? Because the assessment is not enough. How can your assessment support the IEP process?
Sure. So comprehensive assessments can identify areas of difficulties that may not have been flagged in the IEP. Again, the reason for this being is that we're seeing that individual on a broader level, on a deeper level. So we're able to see them as a whole. What we see a lot of times is it can identify areas that might impact learning indirectly, that in areas, again, that might not be reflected in their initial IEP assessment. So this might be like different cognitive processes like, processing speed problems, working memory weaknesses. It could identify social issues, behavioral problems, emotional challenges. All of these things impact learning indirectly. In cases where the eligibility is in question, or maybe the family has been denied for services, it can provide diagnoses that can support the eligibility criteria. So obviously on a case-to-case basis, but
yeah. But for example, a diagnosis of a learning disability in reading that might not have been caught or flagged in an IEP process.
And we should say that a specific learning disability in reading is just how the DSM-5 is classifying dyslexia now. Because lots of times families will come and they'll be like, no, my kid doesn't have dyslexia. They have a
Specific
reading disorder.
Yeah. Well, typically the learning disabilities is a little bit more straightforward for the school to identify. What we see more is like the ADHD
Right.
they might miss, or like autism because it's more nuanced, right? So like if a child is high functioning autism, they'll get denied, but then it's actually showing a comprehensive assessment will show autism.
So let's say they got denied. The comprehensive assessment shows something deeper because the family didn't like the results of the IEP being denied and they felt there was something more going on.
Yeah.
What are the steps that a family takes at that point?
If a family has been denied for IEP and they feel like the IEP assessment hasn't fully captured the child's abilities, or that the assessment plan, the IEP itself, is not meeting that child's needs, they can actually request a IEE. What that is, it's an independent educational evaluation, which is an assessment that's conducted by an evaluator who's not affiliated with the school district. So this is someone in private practice like myself, and they would be conducting an independent, unbiased, neutral assessment of the child in order to support the IEP process.
Who pays for that?
So the family, if they feel like the school's initial assessment was incomplete or inaccurate, they can actually request that the IEE is done at public expense, which means that the school district is funding it. What happens typically is family will request the IEE, and then the school has to respond by either agreeing to fund it, or they can contest it by actually going through due process to prove that their original assessment is sufficient. What I see a lot of times is that the district doesn't want to go through that process and they agree to fund it. Obviously, every case is different.
It depends on the money, right? It's more expensive to probably go through due process than just pay for the...
Exactly. Time consuming, expensive. Yep. And then once the IEE has been completed, the school is required to consider the results of the IEE when they're revising, when they're working the IEP. They're not obligated to implement all the recommendations, but they're required to consider it.
Okay. So why are some children who actually have a neurodevelopmental disorder actually end up being denied? Because I hear about this all the time from parents. So what actually happens? Why would they be denied?
Because the school, when they're making their decision, it's not enough for a student to have a neurodevelopmental disorder. What they're looking to see is that that neurodevelopmental disorder is impacting that student academically. And what we know about neurodiverse kids is that there's often a lot of variability in their profile, right? They have a lot of strengths and weaknesses, and not all of them are necessarily going to be impacted in terms of how they score on that academic testing or how their grades are. So they often have these strengths that can mask or compensate for their weaknesses, and then they don't show up as being impacted in the testing. They don't flag, and the school says, well, you know, this child is not struggling and we don't need to offer services. And this can be confusing for parents because they're seeing on one hand the school telling them, no, they don't need services, but then they know intuitively as a parent, you know, my child is struggling, and then they get stuck.
Yeah, it's happening only at home, or whatever grade they're in, they're able to mask and they're able to compensate enough.
Right.
And then that might change in the future.
Right.
There's so many variables to take into consideration.
And maybe the child is doing okay in school, doing decently, but is spending 4 hours a night on homework.
Exactly.
Or has a tutor and an educational therapist and has all these supports in order to sustain themselves.
Exactly. And that's the part that the school doesn't see.
Yep.
So for parents who are trying to decide which path to go down, knowing that you can pick both, but what advice would you give to parents when they're making that decision between an IEP assessment and a private comprehensive assessment?
So if the parent's goal is to see if their child is eligible for special education services, then the IEP is a good place to start. But if they're looking for a more in-depth view of their child's abilities, then the comprehensive assessment is a better option. Sometimes parents suspect that there is some sort of diagnosis, maybe autism, ADHD, and they're looking to get clarification about that diagnosis. Then again, the comprehensive assessment would be the appropriate route to go. Another thing for parents to think about is, are the challenges my child having Are they impacting them just at home, or is it extending to other settings like home, socially, other environments? And if the answer is that it's impacting them in other areas, that's a sign for them to consider a comprehensive assessment.
I like that rule a lot. If it's impacting them in multiple environments, that is a sign that a comprehensive assessment would be the right step to take.
So if their challenges are extending beyond the school and to other environments, like socially, they're having challenges at home or in other environments, then that is a sign to consider a comprehensive assessment.
Okay, so are there differences in the recommendations a family might get from an IEP assessment versus what you would give as a comprehensive assessment?
So the IEP assessment is going to make recommendations that are school related. Typically, this includes services, special education services like one-on-one learning support or speech therapy, occupational therapy, for example. They'll also make recommendations for different accommodations and modifications. So this might include access to assistive technology, for example, preferential seating, extra time on tests, extra breaks. Those are the kinds of supports that would be included in an IEP assessment. On the other hand, with a comprehensive assessment, again, because we're getting more nuanced information, this allows for a more detailed treatment plan that's more individualized. So we're addressing how to support the child, not only in school, but outside of schools. So this includes therapeutic interventions, family-based or home-based strategies, community resources, and then specific strategies for how to support different brain processes like working memory or processing speed, or how to improve organization for a child, how to create routine in the home. So again, it's looking at all of these areas of support that the child needs in different environments in their life.
Whole child.
Mm-hmm.
So, Nicole, thank you so much for taking the time to be here and share all this information with us. If our audience wants to connect with you, ask follow-up questions, or potentially work with you, what is the best way for them to connect?
They can go visit my website. It's mychildassessment.com. And from there, they can contact me and schedule a consultation, and also browse. The website includes a lot of information about the areas that we assess and about our comprehensive assessments.
Fantastic. Can you say our signature sign off, which is have a great week, Smarties?
Have a great week, Smarties.
Have a great week.
Have a great week.